Implant dentistry is really helping for patients to replace their missing teeth. However, like any other treatment, it might, the failure might happen. In order to have a very successful treatment, either cosmetically, biologically, or functionally, we need to follow some basically steps. We talk to the patient, see what are their expectations, what they really want from getting implant, and is it reasonable or not. And then after the complete exam, including gum health or gingival health, because one of the factors that could eventually cause the implant failure would be presence of any gum infection. And also there's another thing that we do in our office. We have digital technologies. We have CT scan in order to evaluate the bone in the area of potential implant placement three-dimensionally. So that helps us to get all information in terms of the quality and quantity of the bone in that area. Based on that and based on the information we get from the clinical and radiographic, we basically identify the risk factor and then explain it to the patient that these are the risk factors, these are the limitations we have in this area, and we kind of explain it how we can give you a better result at the end. When everything is done, that's not the end of the story. We want to make sure patients understand that performing proper oral hygiene, sufficient oral hygiene is really important. In order to have a long-term success, they need to come and have a regular checkup. So if there is any missing teeth in any part of your mouth, either in the aesthetic area or you're not able to chew properly because you don't have enough teeth on the posterior area or in the back, you can always give us a call and get the complete exam, clinical and radiographic, and we give you all information you need to replace your missing teeth.